The deadline for NHS health workers in England to get vaccinated is fast approaching. To be fully jabbed by the 1st of April, they need to have at least one dose by the 3rd of February. That's little more than 2 weeks away. But our FactCheck analysis shows that over 80,000 NHS health workers in England have yet to receive even a single dose of a COVID jab. And of those, just over 52,000 are not thought to have a medical exemption, which means they're at risk of losing their jobs in April. That's roughly 3.5% of all staff who work with patients, and in some areas it's even higher. Across trusts in London, our figures suggest 7.6% of staff are entirely unvaccinated and don't have a valid medical excuse. So what happens to them? Well, hospitals are hoping to convince as many employees as they can to get jabbed in these final weeks. Failing that, some staff might be moved to roles that don't involve contact with patients. But if no alternative can be found, they face dismissal. NHS leaders in Scotland and Wales have been spared this particular headache, as governments there have decided not to make COVID jabs mandatory. Northern Ireland is considering making it compulsory, but only for new recruits. In England, the Department of Health says NHS and care staff do amazing work and we are thankful to those who have chosen to get the vaccine. And they told us the plan is all about patient safety. But with tens of thousands of vacancies in an already struggling NHS, can the health service afford to lose so many staff?
Well, I'm joined now by Helen Donovan from the Royal College of Nursing. Helen, just hearing Georgina's report there, 50,000 staff going in April potentially. What does that mean?
Well, it's shocking, isn't it? And I mean, at the moment, when we're facing this staffing crisis, what we're saying is that the government have got to put a pause on the legislation that's come in around mandatory vaccination. Making people have the vaccine isn't the way to get them to have it. I mean, the RCN are very, very clear that all health and care staff and all of our members should be vaccinated. But the way to achieve that is by talking to them, trying to discover what their concerns are and encouraging them to be vaccinated. The way not to do it is to force them to do it and to threaten them with their jobs.
Helen, just delving into those numbers there, you hear 50,000, that sounds like a great deal. Would that potentially mean that some services will be cancelled, face-to-face services, cancer services? What is the impact that we're potentially talking about?
Well, I don't know what the impact is, but we know already that the health service is in really, really sort of struggling. You know, we've got 73% of those who arrived in A&E were seen in 4 hours, which is way below what we would want. We know that the number of operations being cancelled and the waiting list times are going up. So the health service is already under a really, really big pressure, unimaginable pressure. And the thought of losing staff as well on top of that is just something that we can't countenance.
But the government has said that this is such a big deal for those, this is their way of dealing with vaccine hesitancy among staff, to have staff vaccinated. That's what they want. You can't just keep pushing back the deadline as you guys want or putting a pause on it, because eventually they're going to want staff to be vaccinated.
And we want staff to be vaccinated. We absolutely want staff to be vaccinated. We know that these vaccines are safe and they are effective, and the RCN have said all the way through that that's the key aim. What I would say, as a specialist immunisation nurse, that's my background, the best way to achieve that is by talking to people, listening to their concerns and encouraging them to have the vaccines. We know that there is a huge amount of misinformation out there, and I would say that healthcare staff are not immune to those messages. So what we need to be doing is talking to people and explaining to people why they should have the vaccine, why it's safe. And unfortunately, that's very difficult to do when ultimately they're facing redundancy or being sacked from their job.
Sure, Helen, just briefly, how worried are you about this situation and how critical is it, just briefly and shortly?
Well, I think your figures sum it up, really. I mean, it is a very, very dire situation. And some parts of the country, as again your figures showed, are particularly challenged. So we are really worried. And what we're saying is the government need to take stock and rethink the policy, basically.
Thank you very much, Helen. Thank you very, very much.